COVID is something where it's changing every day. We get updates every week. The most important thing is not to panic.
Dr. Monique Mazuka is one of the healthcare workers working the front lines. In addition to seeing her own patients virtually, she's also working here at the COVID-19 Assessment Center at Mackenzie Health Hospital.
The patients sort of remain in their car until we have them ready to be seen by a physician or a nurse. And everyone's wearing the protective personal equipment, so that can be a little stressful for some patients. Then we put each patient individually in a self-isolation room, and they wait there and they speak to a physician actually over a virtual platform that we have there, or, there's a glass, so they're separated. And then finally, after they do the assessment, if they deem that that patient needs to be tested, then they are, and someone comes in and tests the patient, and they're immediately sent home to self-isolate until we have positive results.
How have you been handling all this?
Well, we have to keep updated every day, as I'm sure you are. We get 5 to 10 emails a day because everything keeps changing. As long as my patients are not feeling anxious, I'm always reassuring or supporting them and making myself available to them.
Do you think the government is doing enough at this point? Do you think they could be doing more?
Unfortunately, here in Vaughan, we do have a very low supply of medical equipment. Allocate specific primary healthcare practices that can see emergency cases where they will have enough equipment. We do need that equipment to see you safely if there is an emergency, so that's the problem.
As for the public and how they can stop the spread, of course, self-isolation is a main one, but there are other ways you can help.
And the transmission is mainly nasopharyngeal, so through the nose, the mouth, the mucous membranes, the sputum. So again, it's this contact and droplet precautions. The other thing is through, feces. So that's a big thing. Washing your toilet. Don't use the same toilet as someone else who has probably suspected case, or you're someone who's like an essential worker. Use your own toilet, keep to your own room.
Dr. Mazuka says about 100 people with COVID-like symptoms come through this assessment center daily, and about 60 to 70% of these people get swabbed. In Vaughan, Stella Acquisto, City News.